So friends, you've made it to the end. We're at module number 10. Now we have to talk about the legal and ethical issues in DPC. Listen, in this country, doctors and nurse practitioners and PAs do not practice medicine. Lawyers do. So we've got to do the things that we've got to do. Confidentiality. Confidentiality has to be keen, and it gets a little bit tricky in this because we get real chummy. We're really close. In the traditional healthcare model, the patient, there's a get back, stand back kind of mentality where patient's over there and I am the almighty prescriber, and it's not like that in direct primary care. It seems a little more close and intimate, and so the lines of confidentiality can sometimes be easily blurred. So you have to get ahead of it because you're going to be treating in that employer-sponsored model that we talked about. Under that membership, the employer, the church or the lawn service is paying the bill, the membership, but your actual client or patient is the patient. So therefore, the employer cannot know anything that's going on. You can't confirm nor deny. Did the person text you? Did you treat them? None of that. So you have to be very mindful of that yes, I know this is who's writing the check, but this is who you answer to. Also, you're going to be treating family units. I feel honored when I get to treat, you saw that? I don't smoke weed, that's why I can catch it. I love when I get to take care of family units. I'll have the mom, the dad, and the adult children. You have to be very careful because moms or wives are infamous for texting me, can you send John's murmur or Amanda, John's coming in today, make sure you talk to him about, or they tattle on one another. And you just have to go, okay, all right, I'll get with her about that, or I'll get with him about that. Being very, very careful about that because people are in love with one another until they're not in love with one another. And you don't want to be caught in the middle of that. They were together and they were sharing things, and then they get a divorce and you didn't know it or whatever. And now it gets messy. So the patient that you are seeing is the patient who you are discussing. You are not discussing with the husband. Yeah, your wife, I put her on testosterone cream. Yeah, because she told me her libido was low. Nope. If she doesn't go home and start behaving like she's on testosterone cream, you don't tell that she's on testosterone cream. I learned that the hard way. Privacy. My girls are very chummy. Our office is very small and intimate, and it's nothing for my nurse to be talking in the hallway with the patient, or the patient to be talking in the hallway with the nurse, or at the checkout station about things we just said in the office. Now they're at the front desk, blurting it back out for all that can hear. So being mindful of that. So my staff is very well trained that although the patient's blurting out their information, my staff will not respond to them about that, or they'll be like, yeah, girl, telling all the business in the streets, because as you've learned with this time you spent with me, I kind of talk to people that way. And so my staff does too. They're little clones of me, and I like it. Informed consent. Make sure you get you cross your T's, you dot your I's, you get your consents, your photo consents, because in direct primary care, it's so easy for us to pop up a camera and do videos and all that. Make sure you've had that patient sign a consent to be able to use their likeness and image for their before and afters, or for whatever it is that you're posting them for, their testimonials. Make sure that you're getting consents for all your procedures. So yes, this person's been seeing me and they signed a consent to see me for whatever, for primary care, but now they're getting a B12 injection. Let's get an injection consent. Or you've added services like Morpheus, you're doing facials, let's get a consent. I hate it that things are this way, but it is what it is, and we just have to cover our tails because we put a lot of effort over the last 9 modules into building this primo dynamic practice. Let's not lose it all for not having a signature on the consent, okay? And then malpractice. We need malpractice because although you are sweet and kind and you do your best, but you are a human. We are humans and we make mistakes. So let's have some malpractice insurance on board. Because someone will ask, my malpractice broker is Epic Brokers. That's who they find my malpractice insurance. It's expensive. Just know it's expensive. It's expensive across the board because especially if you're in Florida, it's really high here. general liability insurance. Because you own a business, you own a practice, you'll need some liability, not just for yourself, but if someone slips and falls in your practice, you need to be covered. So you'll need some general liability practice. And then lastly, you'll need some property and equipment. If you've got 3 lasers that are over $300,000 in your practice because you're crazy like your teacher, you better cover them in case a hurricane comes prayerfully and snatches them out for you and takes them out the window. You want to have them covered. Also, you want to have property insurance. If there's a flood or a fire, you want to protect your asset. You're building an asset, so protect it. So the one and only pitfall I can tell you in this section is not having coverage. That will get you in a pickle, friend. It has been a pleasure to share this opportunity with you, and there will be a chance. If you're like, Amanda, that was good stuff, but I had a few questions. I need more. We can talk more. You want more? I'm available for more. I'm doing one-on-ones. I'm doing some mentoring. So you'll have that information if that's something that you need. I am so open to having people come in and shadow us here at our practice at Ultimate Health in Leesburg. We've done it over the years. We've had girls fly in from Atlanta. I had someone come from across Florida who came in and spent the day with us. And it's nothing more than you can do it. You can do it. If we're doing it, you can do it. I was just a nurse practitioner, I was a nurse practitioner providing care. I was not a business owner. I was not a business person. I don't come from a family of entrepreneurs. My family, in fact, was like, have you lost your mind? You're quitting your job and starting your own business? But I figured it out. And so I'm here to help you figure it out. So if you want more information, click the link and schedule that time where we can chat. And as always, I will see you soon.